This is the reason why we're here. I can see around me probably 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, about 10 graves which are made out of stone, right? And 1, 2, 3, 4, 5 recently dug graves which are not made of stone, and at least half, if not more, of those graves are children's graves.
My name is DJ Brown. I'm an A&E doctor in the UK, in Hackney, East London. As a result of my work, I've seen my fair share of pain, suffering, and death. I've come to Mozambique to look at how healthcare works here. I'm not trying to solve Africa's health problems. I've just come to see how people in a very rural district of Mozambique might do things better. As a mother in Mozambique, you have a 1 in 10 chance of watching your child die in its first year. That's 20 times worse than in the UK. And even if you survive the lottery of infancy, you're likely to be dead by 40. But the most pressing issue is maternal and child health. I've got 2 weeks to try and make some sort of difference to this one rural district. It's the start of my trip, and I'm feeling positive. I believe that there are small changes that could lead to big improvements. How hard can it be to make sure that the poorest people here get proper access to child healthcare? But I've got to be honest, although I know about hospitals and healthcare in the UK, I'm no expert on Africa. In truth, I have absolutely no idea of what to expect. We're in a town called Mandimba, in the northern region of Mozambique. We're looking for a rare commodity, a doctor. There are so few of them in this district, it's like having only 50 doctors struggling to treat the entire population of Greater London. I'm talking to hundreds of people about their healthcare issues, local leaders, healthcare workers, patients and mothers. Everyone has a strong point of view. I assumed that there would be simple changes to make that could improve matters. But in reality, facilities, staff and adequate money just aren't here. I'm realising that there is a desperate need for healthcare provision at the most basic level. This is the hospital bathroom for the maternity unit. It's got 2 bikes, a bunch of dirty washing, a tractor tyre and some buckets of dirty water. No running water at all. It's clearly unused. They clearly don't wash people either before or after birth. This is primitive in the sense of it not being about modern medicine. It's got the sort of veneer of modern medicine, but it really isn't. It's a really deeply ineffective way of providing people with what they need. What they really need is to understand the germ theory of disease themselves, keep themselves clean during periods when they're most likely to obtain infection, which is when they're like 0 to 1 year and when they're giving birth. And then when they come to the hospital, to see that that's how people are operating. How could you possibly go out into the community and say, hey, you've got to be clean. You want to make sure that you wash your hands before you come to the hospital, and that's not happening. I mean, what sort of an example does that set? I know things are bad here. I know that people suffer terribly and unnecessarily, and as a doctor I have to steel myself to working in situations where people are frightened and in pain. I think of myself as having a pretty strong stomach. I don't usually break down or get angry at what I see. But that's exactly what happened when we met Esnati. Esnati is 16. She's in labour with her first child. She was forced to walk for over 7 hours to get from her village to this pitifully basic maternity unit in Mandimba. Her baby has become stuck in the birth canal. Walking for so long in early labour was one of the worst things she could have done, and now she is totally exhausted. She's been in full labour for nearly 2 days. In the UK, we'd have done a caesarean hours ago. Suddenly, I realise how far this country has to go. After a final struggle, Esnati's baby dies. It seems the critical problem in Mandimba is that the only place to get healthcare is the hospital, and many people live too far away. As I've seen all too clearly, if they do manage to get there, There isn't enough expertise. There's no sense of infection control, no hand washing. It takes us over 2 hours to get to Esnati's village from the hospital, and that's on a bicycle. We then retrace her steps back to the hospital on foot, following the journey she made last night, in the dark, in labour.
Which is absolutely miles from anywhere. Absolutely bloody miles. 10 kilometres at least, by bike or by foot, through the fields. And the woman that we saw this morning, she'd travelled that distance in the dark, in the pouring rain, in the end of first stage of labour. And just the very prospect of doing that fills one with dread, really. It's just unthinkable.
The journey was hard enough for us in the daytime. Esnati had to keep stopping when her contractions came. When Esnati got to this stream, she waited for 3 hours for the boatman to arrive. And once she eventually got across, she then had to climb the hill to the hospital. That took a further 2 hours. It was a 7-hour journey for Esnati. That, in my view, is what killed her baby. At Esnati's baby's funeral, there is grief, but there is also resignation.
I was here at the beginning of last week, and I was just thinking this was the most beautiful place in the world. And now I'm just, I don't know, I look at it completely differently. It's still beautiful, it's still, you know, and yet something's changed.
But after everything I've seen, I'm still hopeful. There is much we can easily do to help people like Esnati and her baby. We can provide the health education programs which will prevent needless deaths. We can also invest in other basic needs, like clean water and sanitation. Crucially, these will all help to develop a sustainable economy in this extremely poor part of the world. But we can only do this with money that you donate. Please, give generously to support our work in Mandimba.